OBGYN here in Asheville. I've had the privilege of serving the women of Asheville for over 20 years. I worked really closely with a lot of the legislators to try to get Medicaid expansion in North Carolina. That was a huge gap in healthcare for women in our region. And I was super grateful that we had bipartisan effort. We had Ralph Hayes from the North County up near Hot Springs was huge in being a part of that. And it's resulted in thousands of women having access to health care that haven't had it before. I have women who haven't had pap smears in 10 years, who have been able to come in and have been able to get preventative care. I've had women, young women who have been able to get on birth control that haven't had access to that. The Medicaid expansion has been huge for our region, and the fear of losing that, as people have talked about before, is really significant. There's currently going to be a $618 million deficit in Medicaid for North Carolina. I just got a letter from the Department of Health, our new Secretary of Health for North Carolina. Starting next week, I'm going to get a 3% cut in my reimbursement for Medicaid patients. So every time I provide care to a Medicaid patient, I'm going to get 3% less. It's huge. We already make significantly less money seeing Medicaid patients compared to private insurance. So if I'm providing a service that I might get $100 for Blue Cross, I'm probably going to get between $40 and $50 for Medicaid for providing that same care, and then I'm going to get 3% less. In addition to that, if I provide Medicaid family planning services, which is different, I'm going to get 8% less from that. So if we are going to take women who are the lowest paid women in our community, who already are struggling, who most of my Medicaid family planning are working moms, and then I'm going to have access to care even less for them. A lot of my colleagues are going to stop taking Medicaid. As it is, we have to try to limit the number of Medicaid patients that I can take into my practice because I have to offset it with private patients, and private insurance pays for me to be able to see Medicaid patients. If I get reimbursed 8% less, I'm going to be able to take less of those women. So it's huge. 8% is a lot if we want to try to decrease unplanned pregnancy rates. If we really want to decrease abortion, the number way to do that is to increase contraception access. I mean, that's just a no-brainer. So instead of decreasing my funding and giving me less money to provide that, that just needs to be across the board care provided by our community. The big beautiful bill is horrible for women in North Carolina. It is horrible for poor women. It is terrible for children, as we've heard from our pediatricians.